I'm Molly McBride, Kroger Corporate Dietitian here at TriHealth Fitness and Health Pavilion with both Dr. Timothy Williams of TriHealth's Queen City Medical Group in Anderson and Kroger Chef Ali. Because your health matters to us at Kroger, we've partnered with TriHealth to show you that living and eating better doesn't have to be time-consuming or costly. Here are some tips for creating a quick, affordable, diabetes-friendly meal.
Today we're going to start with sweet potato chips. So what I did was peel a sweet potato and then cut it into 1/4-inch pieces. You're going to spray your pan, and then we're just going to layer these in here.
Okay.
I'm going to spray it.
To get it to stick, I guess?
And to coat it to crisp it up a little bit.
Okay.
And just sprinkle your seasoning in there. Then a little bit of pepper. And we're gonna pop it in the oven.
Okay.
You want your oven to be at 425. Leave it in there about 10-15 minutes. And then we're gonna move on to the tilapia.
Okay.
So these are just frozen tilapia fillets. Just set them in the pan there.
And then you easily could use fresh as well.
Oh, definitely.
Assume.
Yes.
Okay.
This is just a little bit easier.
And they look a little thawed, so at least
Yep, and you want to
just
make
let
sure
them
they're thawed. Don't want them frozen. And we're using a blackening seasoning, Kroger brand. Sprinkle that on there. And we're just gonna pop it right in there. Tilapia takes about 10 minutes on 425.
Okay. So what do you think are, what would you say are the pillars of a diabetic diet, and is it different for type 1 or type 2?
Well, I believe diabetic diet should be very common sense and very simple for most people. We try to have them to be relatively low in carbohydrate, but not totally restricted in carbohydrate. You know, with low fat, low salt, relatively high protein if possible. Now the difference between type 1 and type 2, many of the type 2 patients need to lose weight. So even though the proportions are the same, we try to cut back calories. Most of the type 1 patients are normal weight or thin and don't need to lose weight, so the difference is mainly the calorie restriction in those who need to lose weight with type 2 diabetes.
Then we have the broccoli slaw coming up with the dressing. And we actually do have a light original slaw dressing you can buy on the store aisles.
We're gonna do about a 1/2 cup. We're gonna mix it up.
Toss that.
So for dessert, we did a sugar-free gelatin. And then I added fruit first and then poured the gelatin over it and then just popped it in the refrigerator. So now we're gonna take the potatoes and tilapia out of the oven.
Okay.
And you know the fish is done when you can touch it and it kind of flakes apart. And we're gonna plate the tilapia
Okay.
right with the potatoes and slaw.
And then the drink you're having with this meal is just a fitness grape flavored mix that you mix with water. It actually has only 5 calories for the packet. And as far as the meal cost, this is all under $2.50 per serving. The total carbohydrates in this meal is actually only 35 grams, which is just a little over 2 servings of carbohydrates. As Dr. Williams and Chef Ali have just showed us, a diabetes-friendly meal is well within your reach. You just need the right ingredients and a little friendly advice from your local Kroger and TriHealth physician. You can find out more about this and other meal planning ideas on trihealth.com. So at what point do you think it would be important for someone to come to a pharmacist and talk about their diabetes or ask just those questions they might have?
I think there's a lot of things that patients need help with when it comes to diabetes. I think there's a lot of different things that they use that can be confusing for them. So I think a blood sugar testing meter is definitely one thing that patients struggle with a lot. So at Kroger, we can really be kind of a helpful person to that patient, kind of show them how to use the meter, you know, kind of walk them through how to test their sugar, how to kind of interpret the results that they get. Also, insulin pens and medications. A lot of patients have a lot of questions as far as, you know, how do you use your pen, how do you inject it? We can be a good resource for them as far as using those products. I think patients have a lot of questions on medications, whether it be side effects or drug interactions. I think we can be a good person to kind of educate them on those.
All right. So if people do continue to have those concerns or they just have something personally they'd like to ask, how can they reach out to the pharmacist?
I think, you know, in person is probably the ideal way because we can really see their, you know, their product or their meter right there in person. But even if, you know, a patient's not using a 24-hour store, they're always available to call any of our 24-hour Kroger pharmacies, there's a pharmacist there at all times where they can get help. So if the patient's not really able to be there physically in person, we can always talk with their caregiver, or they're welcome to call and get to know the pharmacist there on duty at that time, and they will definitely talk them through any questions or issues that they have with their disease.